Good morning, friends. Welcome back to my YouTube channel, Medical Classes by Dr. Srinidhi Kumar Acharya. So don't forget to subscribe my channel and also please give your valuable comments. So as we know, we are discussing about different case studies related to clinical approach to a child with the cough. So in this series, today we will have another important case, which we commonly get it. We will find our routine day-to-day clinical practice. So this is a case. Listen carefully. 4-year-old child came with a recurrent cough and fever since last 1 year. So this is a complaint of the mother. The child is 4 years old and he has got recurrent attacks of cough and as well as fever since last 1 year. Okay, so total history is of 1 year. Onset is always with the fever followed by cold and cough. So initially there will be always primarily there will be fever. Fever comes first and later this will be followed by cough and cold. Cough and cold. This is what mother says. Now she says that fever will remain for at least 3 days and later onwards fever subsides, but that cough will be there for next 2 weeks, almost all 2 weeks, 10-15 days. Okay, so that means fever will be there in the beginning part and afterwards fever will subside, but cough will not subside so easily. Cough will be there for next 10-15 days and the child is badly affected by this cough. And she has also given so many antibiotics and other contemporary medical science she has so shown, and she has given so many antibiotics, but all the antibiotics fail. Okay, whatever you give antibiotic or you don't give antibiotic, cough will be there for next 15 days. Okay, so such a type of recurrence is there. There is once in every 2 months. So in the last 1 year he will give 6 or 5 or 6 this type of attacks. That means almost all in every 2 months. So child will have this particular type of presentation. That means on every 2 months, what happens is he start with the fever, and after fever, the fever will be there for 3 days, and later on the fever subside, and he will be having cough for the next 15 days. And if you give the antibiotics also, this persists. Okay, there is no any much improvement. So since birth he had this problem. So she is telling that since birth itself she has this problem. Now it is 4-year-old. Since last 1 year child she is actually noticed, but when you ask more questions with the mother is telling that to be frank, he has got this problem since birth itself. So in the beginning we thought that it is because of the less immunity and all those things. So but now also it is continuing. To be frank, it is present since birth itself. So since birth he had this problem, and beginning he used to get 3 to 4 attacks in a year. 3 to 4 attacks in a year, and now it is okay to some extent. Now at least he is getting only 1 or 2 attacks per year, and previously in the first year of the life, second year of the life, he used to get 3 to 4 attacks in a year. But compared to that, now it is okay. Now he is only getting 1 to 2 attacks per year. But every time when he get the attacks, this is a presentation. And she is also telling that the attack is coming in every 2 months. Now of course the interval is increased. Once in 2 year, twice in a year means at least in 6 months apart he is getting this type of attacks of recurrent respiratory tract infection. But in between the attacks the child is normal. In between the attacks, that means once the attack is over, he has suffered with the cough for 15 days. For the next 3 or 4 months, now presently he has got no any much problem. Okay, he is playful, doing all the things, and weight is also good. Everything is fine. So this is the case. Now if you see in this particular case, this is actually the recurrent cough is there. Okay, recurrent cough is there with the normal interval. In between there is a normal interval. See, when we see the viral fever, we say that interfebrile period is normal, isn't it? Similarly, when the inter-episodic period is normal, like here, in between the 2 attacks, the child is absolutely normal, playing well, gaining the weight normally. So again, this suggests that this is something related to viral. If it is a bacterial, for example, tuberculosis, suppose tuberculosis, it's a bacterial infection. That inter-episodic interval cannot be normal, So here, one thing is very clear. In between the 2 episodes, the child is normal. That means it suggests that it is something related to viral infection, because bacterial infection cannot cause this type of a presentation. If the child is immunocompromised, that's a different issue. But here the child is not immunocompromised. Child is looking normal. Okay, only this type of recurrent attacks are there. That also fever will be only there for 3 days, and cough is most disturbing. Anyway, so look at the nutritional growth of the child here. It is not much affected. Okay, according to mother's version, it is not affected. She is telling he is okay, he is gaining the weight, he is normal in between the period. Okay, so frequency gradually decreases, isn't it? In the first year, mother is telling there are 3 or 4 attacks per year, and the second year also there is 3 or 4 attacks. Now, actually, there is only 1 or 2 attacks per year. That means as the age passes, the frequency of these attacks is coming down. So now ask one more important question here: whether the fever every time starts suddenly. Okay, so just ask the mother one question: so whether the fever starts suddenly. So mother saying yes, fever suddenly start, and once the fever starts, it will be there for three days, and then the cough will be persisting for 15 days. This is what mother says. That means fever is starting suddenly. So if it is started suddenly with the fever is coming first and then cough, so it is not allergic. So fever is coming in the beginning, that is also sudden, followed by the cough, definitely it is viral. And inter-episodic period is also normal in this case, that also suggests that this is viral. So this is recurrent respiratory tract infection because of viral infection associated with the wheeze. Actually, what mother is telling as cough here, it may not be exactly the cough. It is some noisy breathing which is coming from the mouth. Okay, so this is usually the contemporary science refer this condition as a recurrent respiratory infection or because of virus, or recurrent respiratory viral infection associated with the wheeze. This wheeze is not it's not actually cough and cold what mother telling. It's a type of wheeze sound which is coming from the bronchial area. Okay, there is some airway problem. That's all. So here recurrent respiratory infection is there, so associated with the wheeze. Okay, so we call this condition as transient wheezers, early transient wheezers. So when we see wheeze in children, in the one of the class I already explained, cough basics part 4, I have explained that what is 3 types of wheeze associated problems coming in the children. One is early transient wheezers, atopic wheezers, and IgE associated wheezers. So now this is a transient wheezer. Now you just ask the history here. Whether any structural problem there, for example, at the time of the birth, whether the child has faced any problem, whether the birth is premature or low birth weight, or whether there is problems like cerebral palsy, etc. is there, or resuscitation was done, or whether child was kept in the incubator or ventilator for a long time. So you just ask this history and then you find one of the leading point. Usually this early transient wheezing is quite common in those babies with this particular history. Okay, so you will get some of the history. There is some structural problem, maybe there, congenital problems may be there, or some early interventions will be there, incubator or ventilator stay will be there, especially prematurity and low birth weight will be there. Okay, so such a type of perinatal problems will be there in most of the time. So this is early transient, we will call it as early transient wheezers. Okay, as the age progresses, this will overcome, the child will overcome this problem. That's what's exactly happening in this case also. So child is not now having a decreased frequency of these particular attacks as the time passes, which is told by the mother. So what do you do in Ayurveda? So in terms of Ayurveda, when we look into this particular case, we know that once we know that it's early transient wheezers, what we have to do is we should try to increase the general condition of the child. Okay, you give some immunomodulatory drugs. Okay, so some of the drugs you give to increase the general health conditions of the child. Okay, do for the nidana parivardhana if it is possible. So immunomodulatory treatment should be given, and this is the treatment. Okay, that's all about this case. Thank you very much. We will again meet with another.